Hello, so today we're going to be doing the neurological and musculoskeletal skill assessment. I have Carmen here. She's going to be my patient. Carmen, do you give me permission to show this video to my school for education purposes?
Yes.
Okay. How old are you?
I'm 50.
So Carmen is 50, she's over 18, and she's agreeing for me to show this video. We're gonna go ahead and move on to the assessment, which we already know in this situation. In a real life, I would come in, I would close the door for privacy, I would do hygiene for no longer than 20 seconds. I will introduce myself to my patient, let her know what I'm about to do. Then after that, I would identify her name and her date of birth, and then I would ask her for allergies, and then we would proceed to the neurological assessment, which in this case I'm going to start with level of consciousness. So I'm going to be checking for alertness. Level of consciousness. So I'm going to be checking for alertness, if the patient is responsive, if the patient is drowsy, lethargic, or comatose. And in this situation, Carmen is alert and responsive to stimuli. I did ask her name and her age, so she answered that correctly. I'm gonna move on with the Glasgow Coma Scale, with the which in this situation, we already established that she's alert, but for a patient who is in comatose or lethargic or just not responsive, we would assess a score. For her, it would be a 15, because she's fully alert, her eyes are opening, she's verbally responding, and her motor response is good. I know that for the GCS, the minimum score is a 3, and anything less than an 8 indicates coma, which for a case like that, intubation or, just the airway would be something that would be important. But we've established that she's fully responsive. Now we're going to move on to orientation. So I'm going to be asking her for person, place, time, and situation. Carmen, can you tell me your name?
Yes, Carmen Saavedra.
All right. Can you tell me the city you are in?
I'm in Luling, Texas.
Can you tell me the year?
It's 2025.
Good. And why are you here today?
I'm helping you with the segment.
Assessment, yes. So my patient is orientated ×4, which is good. We know that that's good. Now I'm going to be checking mood and affect, and just talking to her and assessing her. Since I've been with her, I can tell that my patient is calm and cooperative. Now I'm going to be checking her memory for recent and remote. So for recent, I'm going to be asking her, what did you have for breakfast?
Rice and ground beef.
Good. And for the remote question, can you tell me where you were born?
Yes, I was born in Mexico City.
Good, thank you. So my patient is answering accurately to recent and remote memory, and we know that it's intact. Now I would be moving on to motor function and balance and gait. So I'm gonna have Carmen walk normal. Can you walk, Carmen? Just walk that way and come back. Good. And now I'm gonna have you walk tippy-toe. Can you tippy-toe? Good. And now can you walk with the back of your heels? All right. And then now I'm gonna ask you to do something that's called tandem, which is heel to toe. So you put your heel to your toe like this. Okay. Good. Thank you, Carmen. You can go ahead and Sit down. So my patient's gait is steady and balanced, and she was able to perform walking on tippy toes, on heels, and then on heel to toe, which is a good assessment. Now we're gonna move on to the Romberg test, which is just making sure that she has good balance. So Carmen, I'm sorry, can I have you stand up again? All right, can you put your feet together, some feet together? All right, and your hands are gonna stay on the side. If you can close your eyes for me. And I'm gonna be placing my hands right here. Just gonna be watching if she sways or if she loses her balance. Good job, Carmen. Thank you. So you're supposed to do this no longer than 20 seconds, and it was negative, which means normal. My patient had minimal sway and maintains good posture. So you can go ahead and sit down. All right, now I'm gonna be assessing sensory function. In this case, it's gonna be, I'm gonna be assessing the upper and lower extremities. So, Carmen, just let me know if you feel this, okay? Can you close your eyes and let me know if you feel this?
Yes.
All right, can you feel this?
Yes.
Can you feel this?
Yes.
Can you feel this?
Yes.
Good. So, patient is able to identify and recognize the vibration. So I would say that patient accurately identifies sensation. Now, I would, in this case also, I would be using a tuning fork and using it on bony promises, which I don't have a tuning fork, but I'm going to be using this, and we're going to pretend that it's a tuning fork. And so what I would be doing, I would be hitting the tuning fork, and with the vibration, I would be using it and putting it on bony promises like this one right here. And I would just put it there and let her feel the vibration, and then I would have her tell me if she feels the vibration. I could use the wrist for the upper extremities, and then for the lower extremities, I would do it on the toes or the ankles, and I would strike it once again, and then with the vibration, I would just put it on the ankle or the toes, and I would have her tell me if she feels the vibration, and I would have her tell me when it stops. And that's how that would be assessed. But in this case, I can't really do that. We're just pretending. Then after that, I'm going to be moving to the deep tendon reflex. And I would be using something that it's called a reflex hammer that I don't have either. But we're going to pretend this is it. So for the deep tendon reflex, I would be checking the biceps. And for this, I would be, just relax your arm. So I would be checking the bicep tendon. I would be striking it with the reflex hammer on my finger, and she would feel it. So I'd be just striking it on the bicep, and then she would let me know if she feels it or not. And a +2 is a strong and normal. It's a normal score. Then after that, I would be checking the brachioradialis, and this is for flexion. Also, the bicep was for flexion. And this one, just like that. I would also be striking it. So the brachialis is about right here. I would be hitting it for flexion. And even though I don't have a real reflex hammer, when I striked it, she was able to do a little extension there. Then the other one would be the tricep, and for this, I would just relax. I would have her relax her arm, and then with the hammer, I would just strike right here in the elbow, and then obviously it's not, but she would have. We would see if she had, if she would extend that. Then after that, I would do the patella, and the patella is the knee. I would hit strike right under, so her leg is dangling. So we know that I would have a positive reflex, and so I would strike it just right under the knee, and it kind of did a little reflection there. And then the arculus, which is right in the back, right here. This is where the tendon is, and I would just strike both to make sure that it's a positive reflex. Then the other thing is a Babinski, which is the toe flexion, and this is something that I would do with the bottom of the reflex hammer. I would do it in a J, so I would start at the bottom and then go work my way up into a J. And so for this, for the Babinski test, if the toes fan, it's abnormal. But in this case, my patient's tendons reflex are 2+ bilaterally, and so the Babinski is negative. So once we do this, we're gonna move on to the muscular skeleton assessment. So I'm looking at posture, symmetry. Carmen, do you use any assisted devices such as walker, cane?
No.
All right, so and we know that her gait is okay because we've already assessed that. So patient's posture is erect, body is in alignment, and gait is steady, and she doesn't need any assisted devices at home. Now the next part is I'm going to assess her spinal column. So I'm going to have her stand looking that way. So I'm going to be assessing her back and then palpating for the sphenius process, which should run vertically and in alignment. I'm also looking lateral curvature, which could indicate scoliosis, and then I'm going to be looking on the side. Can you turn to the side? And I'm assessing for kyphosis and lordosis, which is just an exaggerated curvature of the back, which she has none. Also, Carmen, turn around, and can you bend forward? I'm just all the way to the bottom. Can you just bend all the way to the bottom? All right. So, all right, you can stand up. So my patient has normal spinal curvature, no tenderness on palpation, which is good. Then I'm gonna inspect and palpate skin, joint, and muscle, which I already did kind of like. So I'm just, inspecting the muscles, the joints. Good. All right, and then I'm gonna inspect her skin for temperature. Good. So her muscles, her joints and muscles and skin are good. So go ahead and sit down. For each joint, so I inspected her shoulders and muscle size and shape, and there's no atrophy, skin color and condition. There's no redness, swelling, or masses, deformities. Now we're gonna do the range of motion of the shoulders, which is, Carmen, can you stand up for me? So we're gonna do something that is called adduction, which is her hands to the side. She can do that. And now can we do abduction? All right. Can you move your hands like this and then up for motion? All right. And then can you do a rotation? And then I'm going to see if there's any shrugging. Nope. That is good. Now, there's no crepitus with the movements, and of course, do you have any pain?
No.
She has no pain. So now we're gonna repeat the same inspection and palpation for the elbows. So we're gonna do flexion, which is, can you flex? And then can you extend your arms? Good. Can you do supination and pronation? Good. Then we're gonna do the same with the wrist. Can you extend up with both hands and then down? And then supination is supination, and then just close your hands for pronation. Good. So all so joints have no abnormalities. And again, do you have any pain?
No.
All right. Now we're gonna be checking the upper extremities. So I want you to squeeze my hands. Good. Now push against me. Good. Okay. Now pull. Pull. Good. So we're going to be doing the lower extremities, which is inspecting and palpating the joint, just like we did in the upper body. I'm going to be also checking for any heat, deformity, pain, swelling. So we're going to start at the hips. Can you, so that's abduct, and then can you do your leg like this? Good. Can you do the other one? Good. Can you extend your leg outward and inward like this? Good. And can you do the other leg? And then inward? Good. So now can you sit down? Well, that's okay, because can you flex your knee, your leg, and can you do the other one? So flexion and extension. Do it again. I'm just gonna be checking. Now do the other one. Good. And while I'm here, I'm gonna be checking for our temperature, which is good. All right, so knees, she's able to do the knee flexion and extension. While she was doing the room of range of motion, I didn't feel any crepitus. And then also, I'm gonna check your ankles. We're gonna do the same thing with your ankles. If you can do the dorsal flex, plantar flex. Good, so the lower extremities are okay. So patient's muscles are firm, symmetrically, no swelling or tenderness. I would say it's a 5 out of 5 on upper and lower extremities. Full active range of motion without pain or crepitus. Now I'm gonna do the peripheral vascular check, which is I'm gonna palpate her radial pulse, and then also the dorsalis pedis pulses bilaterally. So I'm just gonna assess, which is all right. And then I'm just gonna assess right here. Let me see this one. And then I think I only did one on this side, so I'm going to do this one. All right, so patient's radial and pedal pulses are 2+ bilaterally. Skin is warm and dry, and she doesn't have any edema. And this is it for this assessment. Thank you.